focusing on Regeneten. Between October 2024 and till now, 220 cases Regeneten Bioinductive patch procedures are performed in our hospital. According to Shuegel et al. 2020, the Regeneten Bioinductive implant showed early pain reduction from just 2 weeks after surgery, significant functional improvement, and remarkably low retear rate. 1% compared with 26% in the control group. Warren et al. 2025, the use of Regeneten in full thickness cup tear resulted in significant pain reduction, improved functional outcome, and notably low retear rate, 8% compared to 26% in control group. This is a surgical scene demonstrates the fixation process of the Regeneten patch. Typically, 4 absorbable staples are inserted and secure the patch to the medial portion of the rotator cuff. 1. After that, 2 to 3 peak bone staples are applied to the fixed patch to the bone. Finally, additional observable staples are placed as needed for reinforcement, completing the procedure. This is 58-year-old female patient with full thickness rotator cuff tears. Intraoperative finding confirmed, successfully repaired, and MRI obtained 1 week postoperatively demonstrate the tendon well covered with repair site. This is patient with large rotator cuff tear. The surgical finding shows good repair, and postoperative MRI confirmed tendon coverage at the repair site. This is Regeneten. Despite of being massive tear, Regeneten provides strong biologic induction, allowing solid tendon integration. At 3 months postoperative MRI, we can clearly see early biologic healing with well-incorporative footprint. Even large tear can achieve successful healing with augmentation technologies. Even in retear, Regeneten augmentation demonstrates progressively increase in tendon thickness from preoperative image into 1 and 6 week postoperatively. Serial MRI scan shows gradually signal normalization, indicating not just mechanical coverage but also providing bioinductive healing response. Regeneten provides both biologic and mechanical advantages by inducing favorable healing environment and reinforcing the repair site. It's not only enhance tendon integration, but also promote true regenerative remodeling. This combined effect translates into improved healing quality and consistently better clinical outcome, even in challenging cases such as massive and retears.